Okay, Werner Bischoff. I'm the health system epidemiologist and the medical director over infection prevention for the greater Winston market. So I think it started in Germany. I got my medical training in Germany and then came over doing research here in the United States, first at the Medical College of Virginia, and then actually decided to completely come over here, immigrate into the United States, and then I got a job here at Wake Forest. And I started in the research arena, looking at the transmission of pathogens in different scenarios. And then it evolved. My interest also then kind of extended to viral pathogens like common cold viruses. And then, of course, we had SARS-CoV-1 and SARS-CoV-2 and all these coming in there. So that really triggered me. And I'm very interested in the practical applications of the protective equipment that we are wearing. So especially face masks and eye protection, and how does that interrupt actually the transmission of these pathogens. I have done research in that area, and so for the efficacy of face mask and eye protection, we actually exposed volunteers to the influenza vaccine virus, not the real virus that you get kind of during a season, influenza season, but this is the virus that is contained in the live attenuated influenza vaccine. And so we exposed volunteers to that virus, kind of producing a little bit of a cloud that they were sitting in, and then seeing if we could detect actually the virus, and showing if you put on a mask, if you put on specific qualities of masks. So there are surgical masks that are lower quality, and there are the respirator masks like N95s that are higher quality, and looking at the transmission of these pathogens, especially viruses, also with eye protection. And so that is kind of how we went ahead, kind of doing that period of time in my life. And then actually I took on the position here as a medical director over infection prevention, and that limited the amount of time that I actually had to spend on this research. It was more kind of now the practical application of that research in our settings here, especially during the COVID-19 pandemic. We had to bridge that, and so it was kind of at the beginning, nobody really knew how much protection was necessary, and then also it changed during the pandemic when we had a lot of exposure in the population, how that actually changed transmission dynamics. And so it's always kind of that first steps that we have to take if we have a new emerging pathogen, what to do. And I think there is more research, I think, is definitely justified in that regard to reduce harm to our population. And I think that's the biggest one that we have. And this is not just here in a hospital setting or healthcare setting. Broadly, it's also for a community. The expectations then for a community shouldn't be to, okay, every time I walk out, I have actually a prescription for an antimicrobial in my hands. Otherwise, it wasn't a successful visit. So that's the one thing, is maybe kind of, not maybe, but pretty much reassessing the expectations that folks in the community have, what to expect. It may be kind of a stressful time, especially during a pandemic, but it is also a very rewarding area where you can make a real difference. You are pretty much the expert then in responding to it, and that is also very satisfying on a personal level if you can help folks, if you are kind of part of a team that responds to these challenges. So it takes a lot of personal involvement and dedication to get to that point, but then it is very satisfying, and it can give you really kind of a feeling that you are contributing to the overall health of the population.